Mic check 1 2. What's good? What's good? What's going on? World? It's my first time doing this. We'll see what happens and what how it goes, stuff like that. But welcome to the Everybody Relax podcast, streaming on YouTube as well. And I am. Let's see. Hold on. What's happening on this side? Sorry about that. I was trying to get these things together. But anyways, Relax Crew, Everybody Relax podcast, two entities of the same piece. What we doing, Everybody Relax podcast here on YouTube streaming as I also take the audio to put in my podcast. It's been a minute. It's been a minute. I forgot to do my tagline. Everybody relax, but that's okay. Hope that everybody's well. Everybody's doing good. That you're surviving in this COVID slash monkeypox pandemic going on right now, and you're just staying safe and staying out the way. A couple updates. I know I haven't been on podcasting in a little bit, a while. Just been back and forth trying to get my steps together, get my footing. Of course, if you have been listening in the last couple of months, you've known that I had a newborn, so I've been dealing with that. Wifey and daughter are going back to school, so I'm kind of acclimating with that, and also running my private practice and seeing how that goes as well. So, it's been a busy summer for me. So hopefully I'm trying to, get my footing a little bit and slow down some going into the fall. Of course, my book is still in the works. Hopefully, still shooting for October 29th, my birthday to release date. We in the editing stages and should be hopefully up for pre-order here soon in the next month or so. So working on that. That's happening. Still have the Patreon up, Relax Crew, Relax Virginia. If you want to be part of the Patreon crew, please go ahead and share that. That's a monthly group where I do extra podcast episodes over there. And I was doing more so the creative stuff, more so like the business aspect stuff, but I'm gonna separate it up into two things next this time going forward into the fall. It's going to be comprised of two tiers. One tier that's going to be dedicated to business, social workers, creatives, entrepreneurs, anybody that's related in the mental health and social work field that's a creative or business owner. We're going to put you on that one tier. And then the other tier is going to be for clinical supervisees, people who are teaching, searching out for the licensure. We're going to also be doing that as well because I'm a clinical supervisor now in Virginia. So I wanted to kind of break it up in two. And if you want to hear both, if you want to hear the creative business side and also supervisee side, then boom, you have a tier for that as well. So just going to do something different. Kind of just I'm in a weird kind of creative space right now. So don't not sure what to call of it, not sure what to think about it, but I'm in a weird creative space. So hope that y'all can stick with me for a little bit, and hopefully we can make this thing shake. So before we jump into this topic, I want to also discuss that um, as I'm in this creative process, some things will be I'm gonna be changing the podcast, Everybody Relax podcast. So what's gonna happen is, of course, I just told you about the Patreon, which is the paid membership to extra episodes and stuff that pertains to social work and mental health, or clinical piece, clinical side, things of that nature. But what I want to do in this piece is the next thing I'm gonna do is for Everybody Relax podcast. This will be the last episode that is, I would say, strategically social work related, right? I know I mix it up and do a lot of different things, but this last episode will be the one where I'm not doing any I'm not going to be doing a lot more, how do you say, direct conversations around social work in the field of mental health topic wise. So this will be the last episode for the season. What I'm moving into for the next half of the year, going to the fall and winter, is I'm gonna be doing a lot more episodes around my personal self, um, things that my hobbies and interests, and I'm gonna still have the mental health lens to it, but I'm going to be breaking down stuff differently, more creative stuff. So they're gonna be stuff related to my book, Refresh the Journey to Find Peace. Things I'm gonna talk about, and then there are going to be stuff I'm gonna talk about, like in regards to sneakers, and then sneakers, mental health, and mood. Then I'm gonna do some stuff around basketball as well. I wrote a blog back in a couple of years ago talking about the mental health of different Black athletes that are my favorites, and kind of talking about the things that they had to overcome in order to get to where they are, and breaking that down. And so I'm gonna do that. I'm gonna bring that back to the podcast form. And so the themes for the next couple of months for Everybody Relax podcast is going to be strategically talking about all the creative things, things that I like, my hobbies, stuff like that. That's going to be what we're going to be discussing in those next couple of podcasts going forward. If you want more let's say social work related posts, the industry and the structure of social work, and I'm talking about that, that's probably going to be on here on YouTube. And I'm going to change the name up on here on YouTube. If you want extra episodes, direct, very, very strategic, business, creative, the social work, business, mental health, business podcast or episodes, or your supervisee, resident training or resident counseling, intern, BSW, bachelor's level clinician, master's level clinician, and wanting to learn more about some clinical experience, Patreon is going to be your extra episodes, more specific, in depth type stuff. I think that's what I'm gonna go with. So YouTube, social work, the industry of social work, social justice, you know, everything we talk about here on social work, and we're gonna talk about it here on YouTube. And then Patreon is more business, creative, entrepreneur, or clinical supervisee, resident training, counselor, BSW, intern type conversations. And then Everybody Relax, the podcast itself will be more so around, my creative hobbies, interests, blending that with mental health, because it is a lifestyle podcast. You feel what I'm saying? So I know I blend everything together, but this is kind of just where I'm going for everything right now for the rest of the year, and then kind of figure it out from there. So hope that makes sense. Okay. So what are we talking about today? I did a post not too long ago. Shout out to the Free Smoke podcast if you are listening. Also, Free Smoke is my other podcast where I do with my friends, where I talk more about sports and other stuff as well. So I'm all over the place. I need the center. I know. But here we are. So I've been like playing around with different jobs and careers and looking into get into more macro policy social work. When I graduated from George Mason University, my concentration was in social change and policy. And so when I went to even go sit for my hours, I had to do more hours in essential to get sit become eligible for licensure. So I'm in Virginia, of course, and because I didn't take the last clinical class, I was policy related. I was macro track social worker. Virginia is interesting because the only policy related macro social work jobs are typically in DC or RVA state level. And those jobs come in down a dozen, and those jobs also typically require you to have some level of policy or macro level experience. Goes into the conversation around with social work about how they always push the clinical track over the past couple of years in the field. They've pushed the clinical track. So when you get pushed to that clinical track, you end up being clinical. So I've always wanted to do macro social work. I've always wanted to do policy work. And I found myself more so creating stuff from scratch or doing a lot of grassroots kind of work to even get my foot in the door, or even talk about to have a conversation around policy and the field of social work or policy, local, state, federal type stuff. Like I had to do grassroots stuff in order for that to happen. And so, you know, graduating college, right? I go into the field and I go into a super clinical position. I go into crisis work. Now, granted, crisis work has a lot of roots in policy work. Doing crisis affects state policy, federal policy, local policy around assessments, TDO criteria, psychiatric hospitalization, the law enforcement, um, courts, like all of that is involved with excuse me, crisis work. So when I got that job, everybody's like, well, hey, you're gonna get tons of policy work here. You're gonna get a blend of everything because it was community as well. And so I was living by that. I thought, okay, well, cool, I'll get that and start that be, stepping stone to get into policy, state policy, federal policy. Over time, I stayed there for maybe 3 years and I could not um I looked at other jobs, looked at other policy jobs, and conversations would come up like you're too clinical, your resume is too clinical. And I was like, well, okay. And so time went on and or like I think one job was like it was just like I didn't have specific skill sets, even though I do a lot of community work, right? And facilitating on the outside. I'm not maybe not facilitating my main job. I'm doing a lot of facilitating on the outside in the community for jobs that require to be in the community to facilitate. So that didn't line up. And so I continue on, right? I continue on. I do my community stuff. I build my brand. I build my business. I do a lot of speaking, I do a lot of facilitating workshops, mental health workshops. I talk with policymakers at the local level, state level, attend those different things, ask upcoming politicians about, you know, how they feel about mental health and educating them about that. And then all grassroots, of course. And I have a lot of social justice, racial justice background as well, doing grassroots community stuff, right? Some will call it community organizing at times, but that's what I did. I organized and facilitated events that brought politicians to the table, along with the community members and community leaders, all of these different things. So I then transition and I go ahead and I go into working in substance use and working in a medicated assisted treatment, Suboxone treatment program for 2 years, doing case management, and then working with the leaders of that institution to, provide coordination of care to our clients in the actual city and doing that. By the meantime, I'm also starting my private practice doing um, therapy as well. So this is pre-license, and now finally, while as I take my exam to get licensed, I'm thinking, well, if I get my license, that hopefully could open the door for those policy jobs as well, because I have all this clinical expertise or clinical background, and that should translate to some form of policy work. Even though I have a direct policy work, there's elements of micro, macro, meso infused in all the work that I've done, my past experience. At this point, I'm like at least 7 years in the game, 11 years in mental health, or 10 years in mental health, and I'm just like, whatever. So I applied for, when I get my license, I applied for a job, a state job that's, policy related and direct policy related. And I didn't get it, but it was probably for the best, but I didn't get it. But I asked the questions around, like outside of clinical questions. I asked the policy related questions. And when I asked those policy related questions, or I asked these policy related questions to multiple places where I'm talking to these either leaders or I'm interviewing or I'm just in network with them, they also either they agree or they're usually stumped, right? And so in that, I'm thinking, okay, well, all right, obviously I know what I'm talking about. Obviously, I can connect the dots between all three because I worked in the trenches in a sense to see how all these things are connected. Why not give clinicians the opportunity to work in these policy level positions to change policy so it can help the field of mental health grow and be better? The one thing I asked at this state policies position was like, hey, listen, y'all want to do this, y'all want to implement this new thing, this new program, new crisis line number. I love it, but who's going to man it? Who's going to, how are we going to implement and find employees with a mental health clinician shortage, and also crisis work with a turnaround? Like, crisis work, people typically the lifespan, not lifespan, but typically the work span, I would say, if that's a word, of folks working in crisis like 4.5 years. So are we going to turn people over every 4.5 years? Yeah, like we have great intentions, but the execution is very poor because we're only thinking about the pressing problem. We're not thinking strategically on a bigger, larger scale. And the reason we're not thinking like that is because we have too many people in a position who only see the problem and only have one solution from their own scope and lens. And that could possibly become from a policy lens, and that's great. That's fine. You know how to create policy, you know how to and write it, you know how to speak it, you know how to lay it out. But what I found working in the field for so long is that they don't have the real in-depth, real world experience that could put it in practice, that infuses it all together. Like, can you speak to working in a Medicaid program in the summertime to try to make, to try to, meet the needs of our kids who are in TDT or in home, to meet the resources that they need for their family, but also provide them the skills necessary to change their behaviors. And if their behaviors are a product of them being in poverty, or a product of them being having lack of access to resources, how do we approach that? Because therapeutic interventions are not going to just help that. There's more to that needs to be done. This is why I think that single view solutions to intertwine, I would say, scrambled cord of problems cannot work. It's band-aid solutions. And so when I asked those questions in that interview, I was really at it. I was like, what are we doing? Like, if you're gonna implement all of this, you're gonna uphold everything that Virginia has, and you're gonna implement this, and yet you still don't have enough people to man it. The demand is higher than the supply that you have. So what are we doing to address that? And then also to sustain it. How are you going to sustain it? And this is not, and it's another thing I brought up, and I teach about this, I facilitate on this, is like understanding, like, even with the Black population, work with the Black population, and you have Black clinicians, and you have Black clinicians inside these systems who have historically done harm to Black people. Black clinicians all also end up in the same space almost as the clients, because they end up being a part of the system, and they know what that client needs, but they can't get them the resource they needed because it's limited in scope due to the agency of the system that they're working in. And they can't speak up about it because of fear they might lose their job. So it's a double-edged, triple-edged sword, four-edged sword, if you want to say. And that is where I was talking about, where I'm looking at, like, strategically, if you're going to make a true change, right, then it shouldn't take me just to go get my doctorate in order to say I can help make this change and happen. It shouldn't happen that way. We should be able to take ground level clinicians, allow them in the conversation. I know there's some out there, but it's not enough. I know that businesses, healthcare businesses that are business minded first and are good at creating solutions, right? And this is the same situation going on with companies right now. Business-minded folks are providing solutions to the mental health crisis, but it's limited in scope because they're coming from a business perspective. They only see the need and they have a solution. So here's a solution to the need, but it's not practical, and it is practical, but it's not sound, and it comes from one lens and one lens only. Only folks, I mean, not only folks, but a lot of people can't, like, clinicians, especially social workers and mental health professionals, have the uncanny ability to see the whole person and the whole situation, person and environment, and how it's affecting them, and can tell you what they specifically need. But when we say this, it's expressed, it falls on deaf ears, or we don't have that in the budget, or we're going to do this, or we're going to do that. And it's, excuse me, and and it's so opposite of, excuse me, and it's so opposite of what that they need, and then they wonder why it's not working at all. So I picked a fine day to do some podcasting. My voice is still trash. Um, so what happens is, you know, clinicians get burnt out. They feel burnt out. They feel they don't feel heard, and they leave the field. So not only that you bringing in people, they're not staying long because they don't feel heard. We have solutions. I don't understand why we can't be utilized more effectively. Wouldn't that make master's level, bachelor's level, even licensed folks a lot more appreciated that their voices are heard. And that's what's going on. There's a crisis within a crisis at the same point. There's a low supply of clinicians. There's a mental health crisis. We have people trying to solve the mental health crisis solution who don't have no idea of how mental health and behavior health uh, works, let alone the system. You know what I'm saying? So my thing of it is looking at, I say all that to say, right? I interviewed, I'm not interviewed. I responded. I reached out and submitted my resume to a heavy policy position. Um, and got back the conversation that I wasn't qualified enough because I didn't have no policy or research experience. And then the email said that my clinical background was interesting. And I looked at that and I showed it to my wife and she was like, interesting. I was like, interesting. I felt like that was a slap in my face that the 10, 11 years of mental health experience that I have, that I currently work in the field of in the clinical space, the micro space. I've been in the micro space for all my career. And I didn't want to be in this space, but I had no choice because this was going to make the bills get paid. And there was no other options to turn to. I was told my clinical expertise was interesting. And I was just like, that's a slap in my face. It sounds like I might be internalizing a little bit, but I felt as though that's what I'm talking about because I've heard this narrative before when applying for jobs. Although we unfortunately we're not go with a different candidate, and your clinical expertise is interesting, your clinical expertise is unique, your clinical expertise is astounding, your clinical expertise is this. We don't think you're good enough to do the advocacy, the program management, the policy work because you're too heavy clinical. And it was ironic because I never wanted to be clinical. I fought being clinical. I didn't want to be clinical. I was against even getting my license. I fought all of this. I didn't want to go into private practice. And yet I had no choice. And here I am. And I'm just kind of leaning more into it. But it sucks because the field of social work, the field of mental health does a terrible job at not even terrible. It does a great job at putting clinical clinical social workers or clinical mental health professionals on one end of the spectrum and policy folks on the other end of the spectrum. And they act as though they are two different people or enemies. And they act as though that clinical experience doesn't, clinical doesn't pave the way for policy and policy doesn't pave the way for clinical. They act like these two things can't coexist. And it's showing up in the profession and it's showing up in jobs. So at this point in time, like, and it almost feels as though for me, if I don't get a doctorate or go back and get maybe even like a MPH, a master in public health, a master in public administration, I can't do policy work because I am too clinical. And that's not fair because in my clinical work, I have tons of policy and macro level work. You feel what I'm saying? So I think so, but I've seen it all my career, even down from, mental health when I was in mental health and when I transitioned to social work, I've seen the same narrative, this split difference between clinical and policy, and they're on the other opposite ends of the spectrum, even though they coexist with work within the same place. They pretty much they work they if you don't have them together working, then you don't get what you get in the system. But I think it goes back to even the fact of how social work, and I'm flip-flopping back and forth between social work and mental health, goes back into the fact that social work pushes clinical so much, but doesn't, you kind of just like policy, you looked at, you kind of frowned upon if you go on the policy route. And you know what I'm saying, that is evident in the social work program. So I want social work programs to understand we have to do a better job at exposing new social workers to the whole field because they guide each other in practice, micro, meso, and macro. They guide each other in practice. I've seen it happen. So laws have been changing, policies are changing due to ground level organizing in the last couple of years. You feel what I'm saying? So if that guides the practice, then why can't clinicians be policymakers too? Every time I talk to policymakers, they don't have a good handle on mental health. They can do substance use, because technically that's a medical piece that you can kind of address. You can throw medicine at it. You can throw medicine at, you can't throw medicine at mental health unless it's mental illness related. So that piece of that mental health is not clicking. I'm trying to tell people, like, if you would talk to the ground level clinicians, and I've been saying this before I even got to this place in my career, if you talk to the ground level clinicians or the ground level workers, they will tell you how the things should be going, because they're speaking from pretty much experience, but they're also speaking from their clients and speaking on behalf of their clients and what their clients are telling them. You feel what I'm saying? If we're talking about DEI, if we're talking about equity and everything like that, how are we providing equitable mental health solutions to people? And you can't answer that with somebody who has no ground level expertise or expertise in a certain population, but because they're certified in DEI, they did a couple of trainings and they can do this, that, and third, they can they automatically can tell you what they need to do. No, I've seen businesses come in to work with mental health agencies to pitch certain assessment tools and to guide clinical flow. And it's like, if you're not a clinician or never been a clinician before, you have no idea what flow looks like in the realm of a mental health clinic, an agency, or even a hospital. You don't know what a flow looks like. So how can you create something? You just really create, and when you bring these extra worksheets in or extra assessments in, you just add more paperwork and making more clinicians burnt out, which affects patient or client care. So again, they guide each other. They work hand in hand. But for some reason, we think that we have to go outside of our field in order to make things happen, to make things work. And you don't. You have your experts right in the space, down the hall, in the community, in the therapeutic environments. That's your experts. Why don't we lean on them to be policymakers more, regardless if they don't have a master's license or a doctorate? Either way, or if they do have that, why not lean on them more? So I just think that we've done a terrible job at it. Um, I feel like the more deeper you get into one area, that you're pretty much pigeonholed, stuck there, and the only way you're going to get out of it is that you have to create your own lane. But I shouldn't have to continue to create my own path from scratch in order to feel like I'm valid or that I have enough experience and I know what I'm talking about, in order to be respected in that policy space. Because all these things start really from the people. So if that's the case, then why does it take me doing X, Y, and Z from a scratch in order just to be heard? We need, you know what I'm saying? I just think we need more of that. And we need more understanding of mental health. And what does that look like? We need more of, we need more cross collaboration. It's everything's not clinical. Everything is not clinical. I can't provide therapy or therapize, I would say, somebody out of poverty. I can't therapize somebody out of a housing situation. Can't therapize somebody out of homelessness. There is a social and environmental thing that is needed to be addressed. And then we could throw the therapy or the counseling or solution, whatever, throw that beside it. But everything is not clinical. That's what we're missing. And clinicians see that and they experience it every day and they go beyond clinical work to meet the needs of their clients every single day. Every single day. So yeah, that's all I got for now, man. I gotta save my voice because I got sessions later. But this is, it's been on my heart for years. This is not just a one-off thing. It's been years. And shout out to everybody on LinkedIn who, responded to that claim, that long post I did. But you can go check it out if you want to. But just pretty much talk about all of this. Just that, it's just pigeonholing people, and then it's always well, you're just too clinical and can't do policy, and it's like, well, what else do I have to show? And I can speak to this, but yet you're saying I'm too clinical. You feel what I'm saying? So I just it's mind boggling because do I have to get another degree in order to solidify that I am know what I'm talking about when I can just tell you specifically working with my clients over the past years what they've dealt with, what they need is beyond therapy, is beyond counseling, is beyond case management. Like, yeah. So y'all make sure y'all go like, share, subscribe to the podcast. I got a new cover art too as well. I go check that out. Let me know what you think about the episode. You can also comment on the YouTube video. Let me know your thoughts about that. I know I've been getting a lot of comments, and thank y'all for listening and watching. Hope that it was informative and guiding some of my practices, or at least challenging some of that narrative that we've seen in the field of social work. And I'm only speaking from my experience. It might not be the same experience for everybody. Some people like, and I know some of it is location too. Virginia is very unique. Virginia has a unique need because we're rural and city mix at times. But I've seen different policy positions in different areas of this of the country, um, and so it might just be a Virginia thing. I don't know, but it's something I've been seeing since getting into the field of social work. And because I was a social policy, I was a policy, um, track person, there was no opportunities. At least, I had to go to DC, and then I couldn't get into in the state because I didn't have enough experience. And then DC, it was still a struggle because I still didn't have no experience. I just had strictly clinical experience. So actually, I had nonprofit experience too, but facilitating, but that still wasn't enough. So it's just frustrating at times, and it's just interesting, like because as the person that a social worker that I am, the type of person I am, I see the bigger picture. I want to do more work and help in the bigger picture, but it's hard to get those opportunities. And it's frustrating because stuff I talk about in therapy or stuff I talk about my clients, I want to address the bigger stuff to help them versus 60 minutes and we just talking about the stuff that's going on. It's a relief, but you gotta go back to that. You know what I'm saying? So yeah, I don't really care for it like that. So like, share, subscribe to the podcast. Let me know what y'all think about it, man. Hopefully this video comes through clear and we can, keep it popping. But look out for the new episodes coming. This is the last episode for this season, and we're gonna shake it up and do something different going forward. All right. Y'all have a good week and stay blessed.